with the liver first, we delay the primary more. The cancer may become more progress locally because some cancer does not respond to chemotherapy. Also, may give secondaries in the lung and the liver. At the same time, complication with surgery does not delay in chemotherapy in most centers now. Put in mind the complication of neoadjuvant chemo and the target therapy. Also can do a prospective study in pre-operative chemoradiation and put in mind the surgery for the rectum and the liver as the same setting. Thank you.
Right, absolutely right. Every case is different from that, and the clinical situation is the main issue for our decision. As the previous slide for Dr. Salam, the clinical situation.
Okay, Dr. Khalid.
For Professor Wafa Mitnawi, please, when you discussed about doing the battery of gene sequencing on the paraffin block, sometimes you are faced with a patient coming with an old family history of a father or an older brother. Is there a validity, a time frame to use these tissue paraffin blocks after how many years that it's obsolete or can't be used? Thank you.
Yes, this is a very limiting factor, in fact, the size and the quality of the paraffin block. And this we appreciate first, or we assess firstly, by looking to the quality of DNA before running the sequencing. So this is a must, of course, and I urge the pathologists to give to the theaters in the surgical theaters, buffered formalin. Buffered formalin is very good to keep the integrity of the tissue of the tumor and can be kept in this case for years. But if the formalin is bad, it damages the tissue and damages the DNA and degrades it to an extent it is not sequenceable. That is why now,
at the end of the session,
that is why we now look to the liquid biopsy. In the metastatic setting, we get blood for RAS mutation and for EGFR mutation in the metastatic cases. So this is a very good option if we fail to get good paraffin blocks.
Thanks, Dr. Wafa. Finally, I would like to thank all our speakers today, Dr. Wafa Mitnawi, Dr. Yasser Abdelkader, Dr. Ikram Hamid, Dr. Ola Khurshid, and Dr. Salim Eid. And of course, I would like to thank our chairman, Dr. Abdulaziz Bilal, Dr. Khair Abdelkarim, Dr. Amr Sa'ar, Dr. Hisham Tawfiq, and Dr. Muhammad Al-Ftuh. Okay, I think it is time for lunch. Thank you.